I welcome the opportunity to speak on and indeed to support this motion. The Vision for Change document launched in 2006 was a template for a community-based, progressive and modern mental health care system. Today, 10 years later, there is a crisis in our mental health services arising from and compounded by the failure to implement that Vision for Change policy. Mental health services in my own constituency of Tipperary is a case in point and highlights the malaise in the service currently, both locally and nationally. Despite the best efforts of staff, the service is dysfunctional. Your predecessor, Minister, the former Labour Party Minister Kathleen Lynch, closed the inpatient unit at South Tipperary General Hospital, St Michael's unit, and transferred South Tipperary patients to Kilkenny and North Tipperary patients to Ennis. That was in 2012. She sold that closure on the basis of a promise, a quid pro quo, that we would have a Rolls-Royce community-based service. 3 years later, we have the worst of all worlds. No inpatient service, and I come back to that. An understaffed, under-resourced and underfunded community services. Our community-based teams, multidisciplinary teams supposedly, are struggling to provide a safe service. They are deficient in terms of staff right across all categories, nursing, medical and indeed paramedical staff members. The promised crisis house has not, of course, materialised. As I said, the inpatient service has been transferred to Kilkenny for South Tipperary and Ennis for North Tipperary. That means assessment of patients has to take place in a busy, overcrowded A&E department with no privacy or confidentiality. The unit in Kilkenny is overcrowded regularly. There is difficulty gaining admission, and if you gain admission, there is early discharge. The situation is completely unacceptable, and I would call on the Minister, and I will finish on this, Ciam Corla, I would call on the Minister to immediately implement the Vision for Change document, including the 24/7 services, to recruit additional nursing, medical and paramedical staff for the multidisciplinary teams, to reopen St Michael's unit in Tipperary, and I would finally like to thank and acknowledge the work done by the various voluntary organisations in this whole area, community consumer mental health panels, Seesaw, Suicide Awareness Group and indeed others. Thank you.